Good morning, everyone, and welcome to the ForMed Plus Learning Lunch event on March 17th regarding creating a culture of compliance in the healthcare workplace. I realize that we are at a very unique and challenging time in healthcare right now. We obviously launched this event prior to all of the recent pandemic news, and so we appreciate that everyone is here in attendance with us. We do feel that this event was worthwhile to maintain at its time spot, given its topic and subject matter around creating a culture of compliance, compliance being perhaps one of the more important topics as it relates to our current healthcare situation in this country and around the world. My name is Wendy Whitmore. I'm the Chief Learning Officer here at ForMed Plus, and we like to bring these learning lunches to the broader healthcare community on a fairly regular basis in order to address subjects like this that are relevant to the healthcare learning audience that we work with and that we reach out to on a regular basis as it relates to our online continuing education projects. So today, hopefully everyone can hear me. Today, the subject, as I mentioned, is discussing the creating a culture of compliance. It is a distinct challenge in any healthcare time to deal with compliance requirements in the healthcare industry. There are numerous regulations, licensing demands, government requirements, and it can really present a heavy burden on medical professionals in order to get all of this information assembled and addressed and dealt with as it relates to employees and staff and managers in their primary care environments. In order to talk about this today, we've brought our subject matter expert, Dr. Nyama Malachi, to the table to have a little Q&A and a little interview around the subject of creating a culture of compliance in healthcare. Nyama is the CEO and principal consultant of the Social Consult, which is a consulting agency specializing in leadership and achievement that talks about organizational development and performance improvement, corporate wellness, etc. We felt like Dr. Malachi was a good choice for this particular workshop because she does work with organizations and leaders, empowering them around organizational development, and we felt that this specific topic around compliance was very relevant to organizational development and cohesiveness, and we felt like Dr. Malachi would be someone good to speak on this subject around creating a culture of compliance. So welcome, Dr. Malachi.
Thank you very much. I really do appreciate it, and I appreciate the opportunity to be here and speak with everyone today. And I did want to add on, just as far as compliance is concerned, as far as getting information from me, you are in very good hands. I've worked as a compliance officer for over almost 10 years in the healthcare industry, and I've probably interface with every regulatory agency you can possibly think of, including the FBI, which was a little concerning. It wasn't about me, thank God. It was about one of the patients. But I have interfaced with a lot of different regulatory agents, and I'm very familiar with the things that regulatory agents look for and the things that you should definitely be concerned about for yourself as well as for the patient and the organization.
Well, thank you. I appreciate that extra bio information. We will make sure to reference some of that additional bio information when we do follow-ups with the group. So thanks for joining us, Dr. Malachi. We appreciate it. And I think we're going to just jump right in. One thing I will mention, just as a housekeeping component, is during this live session, if you have any questions for the subject matter expert or for myself, feel free to connect using the question link in your webinar dashboard and type questions to us quietly. We have someone monitoring that question link, and we can perhaps assemble those at the end if we have time. If not, Dr. Malachi will address them one by one, and we will issue answers out to those questions in our follow-up email after the session. The other piece is that we are, in fact, recording this session. So the good news for you is if you can't stick with us for the whole time, or if you're have other colleagues that you'd like to share this information with, we will be sending you a link to our YouTube channel, direct link to this particular session recorded, and you will have access to it after the fact. And additionally, I know that we did connect with registrants for this particular event, promising them a code for a free CECME course in our format training catalog, and we will be sending that out via email after this session as well. So all of that is housekeeping steps. Thank you for your patience, and we're going to just jump right into our first question for Dr. Malachi. You know, as we wrap our heads around creating a culture-based compliance program, what would you say are the 5 most important reasons that you should put together a compliance program that has some kind of connectivity to the organizational framework?
So the number one reason above all other reasons is patient safety. So you want to make sure that the services that you are delivering are being delivered safely. And that's why you want to make sure that you have a compliance program that is in place. And you want to make sure that you're promoting your compliance program within your organization for that exact reason, to promote patient safety. Because the number one reason we're all in this business together is for our patients and to make sure that they are well and that they do not have any harm done to them. The next reason is to encourage staff confidence. And so when staff members feel as though they are stakeholders and they feel as though that they have input in the organization, it boosts their morale. And not only does it boost their morale, it also boosts their confidence. So allowing your staff members to know that they're responsible for the compliance within the organization gives them additional confidence, which only makes the organization perform at a higher plateau. The next reason is meeting. Yes.
I was just going to stop you briefly on that point, Niama, which is to say that, you know, from my perspective as a learning officer in the industry, one thing I have noticed is that the more that you impose or involve an understanding by the global staff in the compliance program itself, and by that I mean, you know, improving and increasing their awareness of your policies and procedures, and we'll talk about that in a little bit, in addition to making sure that they feel confident in their training and awareness around the various components of the program, the more overall confidence they will feel as it relates to participating in those programs. Sorry, go ahead.
Yes, definitely, because they feel as though they have additional responsibility, or they're responsible for compliance and to making sure that the organization complies. So they definitely will be much more encouraged to be involved.
Right, exactly.
The next reason would be meeting regulatory requirements, and this is a huge one. As we know, more and more every single day, we see how organizations and hospitals and get in trouble because they're not complying with regulatory standards. And although sometimes regulatory standards can be tedious to comply with, they are there for a reason, and they're there to protect the public. And so we want to make sure that we're promoting a culture of compliance, and we have a compliance program that actually that is in line with the regulatory requirements, mainly because they are agencies who actually license our organizations, and there's really no alternative but to comply with them. And it's just it becomes very daunting for your organization to not be in compliance with the regulatory requirements and having to um, constantly catch up to the requirements rather than be preventative and on the front end, where you're already driving a culture of compliance. You never have to worry about not being in compliance and then just driving your organization based on trying to get into compliance. It's a
Right.
really
Right.
difficult place for an organization to be.
Mm-hmm.
The next
Absolutely.
one is to
Yeah.
establish an organizational framework. And so I am going to talk a little bit about the coronavirus and why it's very important to have a culture based on compliance at your organization for times like this. So your compliance program provides an organizational framework for how to manage various things at the organization. For one aspect of that is how to manage emergencies. And so when it comes down to emergencies, here we have now the coronavirus, um, and aspects of the coronavirus that are affecting organizations at a very, very high rate. And so without your culture of compliance, without knowing that you're supposed to already have an emergency management and plan, your organization would wind up, or could definitely wind up, in a very, very difficult situation trying to now come into compliance with emergency management. And so that's one of the five for establishing an organizational framework. It establishes various ways that your organization should be managed and should be run based on risk to the organization. And then another thing is avoiding legal action. So your compliance program really sets a framework for legal action that could be taken against your organization. And I've noticed that the more an organization complies with various regulatory requirements and complies with the compliance program, the less the organization is at risk for legal actions.
Right. And, back on the organizational framework piece, I think that was a good point. What we are seeing right now with everything that is happening in our healthcare communities at the moment, and as we hear more news stories about the states and the various facilities that are blowing through their equipment and supplies in very quick order. So, if the build of your organizational framework is structured around an incident that is, perhaps much simpler than the one that we're dealing with right now, then the supplies that you've amassed around that compliance program, and with the idea that, you're able to address immediate issues, that can be compromised pretty quickly if there's not some kind of framework around it that says, for instance, if the emergency is of a scope of 100 impending patients in our system, it should look like this. If it's 1,000, it should look like that. It's and building an organizational framework that everybody understands, that the staff can feel confident that they understand, that meets your regulatory requirements, but perhaps exceeds the regulatory requirements. I think one of the challenges in the regulatory system is we all feel like we're overburdened by it. Too many forms to fill out, too many awareness programs to launch, too much training to follow up on, that kind of thing. But it is in these moments, the crisis that we're experiencing right now, that we understand why those requirements exist and what those frameworks should look like going forward. So I hope that, obviously when we built this particular workshop, almost none of this was happening. So, the fact that we're able to take some of this information and sort of wrap it around the current crisis and what's happening in the moment is somewhat poignant. We do have an especially unique challenge on the healthcare side right at the moment, and all of these points as part of this session are relevant. Ensuring patient safety,
Absolutely.
top of the queue, always at the top of the queue. Encouraging staff confidence. I think what's happening a lot right now is that there's some panic on the medical staffing side because there are so many unknowns, and because many, many, many organizations did not have a solid organizational framework around their compliance programs. And so there's an ebb and flow of staff confidence around what's happening right now. So I feel like, when you start to think about what are the most important reasons for creating a culture-based compliance program, you're talking about how utilizing some of these identified resources and ideas can help going forward. Would you agree with that?
Absolutely. And even so, just to speak about emergency management, the Joint Commission actually has the exact amount, and they have a formula, and maybe your environment of care person actually has this in their emergency management plan, but they have an actual formula that all organizations who are accredited by the Joint Commission are supposed to use in order to determine the number of food, the amount of food and the amount of water that this facility is supposed to have on an emergency basis, other than what they're supplying to their patients at the time. So
Right.
being in compliance actually will help hospitals manage their emergencies like the coronavirus a lot more than having to manage and do it on their own.
Yeah, absolutely. And those guidelines are in place because over the course of time, there have been enough incidences, not of this magnitude, of course, but enough incidences over time that some of these adjustments have been made to the regulatory system and to the compliance system. And I suspect, given what we're experiencing right now, there will be a bigger adjustment to some of these requirements going forward. And you'll want to review that and incorporate that as you start to build out your compliance program, both during and after this crisis as well.
Absolutely.
Interview question 2, it's a little bit of a hammerhead, sort of repeating what we just talked about in question 1, but I think you can expand on this a little bit, right? Talking about who are we protecting? What is the point of this?
Yeah, so it's a little more, we can expand on a little more. So we are protecting the patient, number one, and the patient safety is always first. And we should promote within our organizations patient safety being number one above all else. We're also protecting the organization and the livelihood of the organization. Because without the livelihood of the organization, then you will not be able to serve patients, nor would you be able to serve staff members as well. And then when it comes to staff, more and more we've seen, and there was actually a recent ruling that came out within the last 10 years or so, where not only are organizations being held liable for things that may be out of compliance, but they're now holding the actual staff member personally liable. And the staff member no longer has that protection of being under the umbrella of the organization, and they actually now can be sued or face legal ramifications on their own, which is really unfortunate for the staff member, but it's also the reason why and the purpose of having a compliance program and making sure that your staff know the details of the compliance program.
Yes, absolutely. Absolutely. Just kind of understanding the underpinnings of developing and framing out a compliance program. Can you speak a little bit to what's behind it, what's driving it, what exactly are those listed elements of impetus to create these compliance programs?
Absolutely. So for the compliance program, there's 5 different things that drive the compliance program. One is your organization's policies and procedures. So the compliance program should be in line with your organization's policies and procedures, and your organization's policies and procedures should reflect what is in the compliance program. They are synchronous. They're synchronized, and they should not be two separate bodies of information. Of course, you have your compliance manual with the information, and you have your policies and procedures with the information. But when you look at one and you look at the other, they should both read very similar. So that it's definitely driven by the policies and procedures within your organization. And then it's also driven by rules and regulations. So rules and regulations of governing bodies like the Center for Medicaid and Medicare Services, also known as CMS, by your state health board, by even your city health board as well, in addition to some federal policies and procedures and some federal laws like EMTALA, as well as HIPAA, which is a federal law, and other federal mandates that are out, like whistleblowing as well. It's included in there. Also, accreditation standards. So if you are accredited, there's CARF accreditation. I know this program is highly looks at Joint Commission accreditation. So a Joint Commission standards should drive your compliance program. Also, the legal considerations should be driving your compliance program as well. And when you make decisions based on how to act in certain instances, you should make decisions based on what is in your compliance program in order to avoid legal ramifications later on. And then lastly, every organization should have a quality assurance performance improvement plan. So the quality assurance performance improvement plan is actually a way of looking at whether or not your organization is in compliance by measuring, auditing, and then measuring certain standards and certain criteria based on all these different regulatory requirements and your compliance program. And then once you actually look at that criteria, if you see that you're not within compliance, you have to make a plan to come into compliance. And then once you make the plan, you have to implement the plan, and then you have to follow up to make sure that the plan that you implemented is working, and to make sure that you remain in compliance. And every organization should be doing that. There's various ways of how you can decide what to measure and what to look at, but you definitely need a quality assurance program that drives taking a look and analyzing your compliance program.
Yeah, and I would also mention that on the policies and procedures side, obviously we're talking about the hospital policies and procedures and the alignment of that. I do know that registered for this particular session, we have a lot of medical group managers and practice managers. And I just want to say that the policies and procedures that you build internally to your organization, while they will be potentially different from what would be relevant in the hospital policies and procedures manuals for an owned, if you're owned by a hospital, or if you are have admitting privileges at a hospital. Obviously, those policies and procedures for your individual organization might be a bit different, but you want to make sure that your staff and the program that you're assembling addresses the policies and procedures of both of those things, not just that of the hospital, but internally, how you've got that set up and structured, and what it is that you're that you internally require of your staff around that compliance program as well. So I just wanted to make sure that we were covering both of those bases.
Absolutely. And for the medical staff on the line, there's also medical bylaws
Mm-hmm.
that are synchronous with policies and procedures for an organization.
Right, absolutely. So let's talk a little bit about who in your organization is driving the compliance program. Who should you have identified in your organization to wrap their arms around a compliance program? And I just want to speak to this briefly for a moment. As an educator, working a lot with compliance managers and directors, we have a number of different regulations that require that we identify a compliance officer at every medical site. HIPAA, as you mentioned earlier, is one
Absolutely.
reason, right? The security officer, very, very, very important. But at the same time, there are lots of different aspects to compliance and building a proper compliance program. So you want to make sure that while a HIPAA security officer is in place, and for your site, for every medical site, and that they fully understand all of the HIPAA requirements and regulations set down by HHS. There are lots of different areas of compliance that need to be covered, and Dr. Malachi, you can speak to that, but I just wanted to make sure that we understood that compliance is a multi-level area of focus for every healthcare site. HIPAA is just one piece of that, and somebody who understands patient health information protection isn't necessarily the same person that would also be focused on the quality piece or the risk piece.
Right. And also, so for HIPAA, you would have potentially have a privacy officer who may not actually be the compliance officer. And then I've interesting enough, I saw at one organization they had the human resource director who was the compliance officer. You don't see that too often, but I have seen a human resource director assigned as the compliance officer. So as you said, Wendy, every organization does need to have a designated compliance officer who's responsible for driving the compliance program. And then you'll also see a quality director, and that title is changes at various different organizations. But you'll also see a quality director, potentially a risk manager. A risk manager really looks at like more the legal side of things, while the quality director looks at the quality assurance and making sure that the program is in compliance with various accreditation standards and rules and regulations. And then your CEO, your owner, your practice manager definitely should be a part of the compliance program and driving the compliance program. Again, because we're talking about the viability of the organization as a whole. And actually, all of this funnels up to the chief executive officer, the owner, and the practice manager. And I always like to say that, the risk manager, the quality director, they should be very, very close to the CEO, and they should have a very good working relationship.
Yeah, I mean, I think the difference between a compliance program and a culture of compliance, from my perspective, is the inclusion and the involvement of all elements of the staff.
Absolutely.
Wrapped around the whole experience of making sure that you're meeting all of those requirements. I think, when it gets pushed off, I think one of the problems with compliance is that it gets pushed off to the HR manager, or it gets pushed off to, a single representative at the site who all of a sudden is responsible for all of the reporting, all of the receiving of complaints, all of the documentation, etc. It becomes overwhelming for a single person, or a small group of people, and subsequently things get dropped, things get missed, processes don't happen, or if they happen, they're not happening as efficiently as if the whole group were involved and engaged.
Yes, and that's why it's very important to promote a culture of compliance, because if you're promoting a culture of compliance up front, that's going to decrease the amount of complaints and decrease the amount of concerns going into that compliance officer, and it'll make a much less overwhelming job for the compliance officer. And I've seen that where I've seen a patient advocate who every single time a patient went up to a staff member and expressed a small concern, the staff member, as opposed to trying to work and help the patient, they will immediately send them to the patient advocate or immediately send them to the compliance officer. But if everyone knows they're responsible, that'll decrease the amount of complaints and concerns from patients.
Right. No, absolutely. Moving on to our halfway mark here, let's break it down. What really are we including when we talk about a compliance program? This is, this can be a little bit different from group to group. There are some medical sites that have additional requirements to this list, but I think this creates a sort of a nice framework or a baseline for a good compliance program. So let's break this down. What are we talking about with each one of these pieces?
So you definitely want to have written policies, procedures, and standards of conduct listed in the compliance program. And you want to address in those policies and procedures and standards, you want to address things like patient abuse. You want to address things like HIPAA. You want to address things like EMTALA and whistleblowing and things of that nature. So you want to make sure all of those things are included in the written policies and procedures. Also, discrimination and harassment should be included in there as well. You want to designate a compliance officer, and we've spoken about that previously. And then you also want to make sure that you have an effective training and education program. And it should be an ongoing training for compliance. It should always be discussed in meetings. It should always be discussed in any time that you get together as a group or a team. And it also has to be very formal that staff are trained on the compliance program. And they also should attest to their understanding, and even go as far as having them complete a competency to show that they are aware and understand what is included in your compliance program. Also, effective lines of internal staff communication. And just an example of effective lines of internal staff of communication is basically it should indicate who things are reported to. Who should they go to when they have a concern? How was that information communicated within the organization? Also, internal monitoring, auditing of policies and procedures, and that goes to a little bit of what I talked about before as far as having a quality assurance and performance improvement program that's included in your compliance program. Also, enforcement of standards through clear disciplinary guidelines. So it should be indicated what happens when someone is not in compliance. And it also should be indicated in your compliance program what could happen when they're not in compliance. And most of the time, it states in compliance programs that the organization does not take, any excuse for not being within compliance, and discipline can include and be up to termination from the organization if an individual fails to act within the compliance guidelines. And then also fast and effective responses to offenses with clear corrective action. So again, it does not always have to equal termination, but it should be indicated that the seriousness of the compliance program should be stated well in documentation.
Yeah, absolutely. And Dr. Malachi and I were talking about working with various groups who are building compliance programs at different points in our tenure. And I thought it might be helpful to give a few tips along the way. Obviously, I'm an online educator, so I'm very in support of, promoting programs that verify compliance training in the staff organization, online training can be very flexible and helpful, but if you are a group that does on-site training, that can be effective as well. But what you want to make sure of when you're doing on-site training is something that Dr. Malachi mentioned, which is to confirm that people were listening. I think sometimes compliance level training, first of all, it can be very boring. People have to take the same kinds of training year after year. They've heard it again. It's kind of like sitting on an airplane and listening to people tell you about how to buckle your seatbelt. You know how to do that. You're not really listening. You're not really looking at the information. God forbid something happened where the seatbelt policy changed and you had to do something differently. I'm not sure anybody would get it because of the fact that we tend to not listen to that kind of training on a fairly regular basis, and it comes at us fairly frequently. So one recommendation that I would have is to make sure that you're documenting that people are paying attention. There are lots of different ways to engage people on the training side. If you're using an in-person versus an online training, with online training you'll get assessments and things along those lines, and you'll know that people were paying attention if a training is structured correctly and they're assessed regularly. But if you're doing it in person, you might want to give people little pop quizzes. Toss out, if you've just been presenting for 10 or 20 minutes, pop out a question. Ask somebody, ask the group if they have an answer to something that you've just presented. Have those ready to go. That's a good way to make sure people are paying attention. And then the other piece is on the policies and procedures side. That's another piece I've noticed industrially that people tend to either, sign a document that says that they've read it when they haven't, etc. One recommendation from an employer that I worked with was to bury sort of a funny or interesting question interior to the policies and procedures, so that when you ask them to sign the document that says that they read it, you can ask them about that unusual element of the policies and procedures, and that's how you'll know whether or not they actually reviewed them. So those are just a couple of recommendations in that regard, because it is important to meet those training requirements. So moving on the communication side. So we just talked about that a little bit, right? Communicating to people that on a fairly regular basis, what is included in that compliance requirement. From your perspective, what are good communication options for organizational compliance?
So definitely departmental meetings, and just to make sure that you have an ongoing table item on your agenda for every single department meeting that addresses an area of compliance. That's really helpful. It doesn't have to be the same thing every single time, but it definitely should just be something on the agenda each time you meet with your department. Also, now signage and announcements. So coronavirus, again, for an example, hand washing. Hand washing is important as regards to infection control. Signage. You should definitely have signage. If you're posting a signage, the signage has to be laminated. It cannot be paper because you have to be able to clean the signage for infection control purposes. But signage is always very, very helpful for people as reminders and as visual cues. You can, with the advent of technology, you can have your signage be electronic type of signage. Some people have, and organizations have televisions, and on the televisions, they include information on the televisions. There's various ways that you can get the information across, but signage and announcements should be used. You should also have a monthly organization initiative where you look at different performance measures, and as you see your measure increases, you can have some type of celebration within the organization, and you can just continue to look at that all the time and always celebrate it. Again, ongoing training within the organization across the spectrum. You can do a monthly organization training, but you definitely have to train annually on your compliance program, and make sure that staff members are attesting to understanding it and even doing a competency on it at least annually. But I would suggest biannually ongoing organization-wide compliance. And then also what I've seen is something called the Safety Champion Initiative, where staff members who are promoting or showing that they are really paying attention to the compliance program and really trying to keep patients safe would be awarded with something, sometimes a trophy or sometimes a gift certificate or something of that nature, but they're giving an incentive to be thinking about compliance and being involved in compliance.
Yeah, I absolutely agree with that. I have been connected as an educator with a lot of different compliance programs, and I would say that those programs that incorporate some kind of incentive for the overall staff, the team, to come together to understand annually their policies and procedures, to understand what is required of them on an annual basis regarding that compliance program. Those employers, I've noticed, have had a much better buy-in from staff, and it can
Absolutely.
be really simple stuff. Yeah, it can be really simple stuff. A pizza party, right? When you're having your group meeting and it's focused a lot on or heavily on policies, procedures, and compliance components, that sort of thing. Somebody that gets the best score on the online exam for their annual HIPAA training, they get a special gift certificate, something like that. So engaging the staff in some kind of team building, connectivity around it, I think can be very beneficial. So let's also talk about what should happen if there are concerns around adherence to the compliance program. Obviously, there needs to be some anonymity options available, but can you talk to that a little bit?
Yeah, so staff really, while I worked as a compliance officer, and anytime I did any training, I always let staff members know that I had an open door policy, meaning that at any point in time, they can come into my office and they can let me know their concerns and they can let me know what was going on, and I would absolutely 100% address their matter and get back to them about that. Some that may not work for you if you need a more structured day, but I felt like leaving my door open, let them know that they can come and report things to me and that their concerns would be taken seriously. So you want to let your staff know that they can come, have someone that they're designated to talk to. They can go to their supervisors, they can go to the compliance officer, they can go to maybe human resources who would tell them who to report to. But you want to let them know that they're okay to report compliance matters and that they will not be retaliated against for reporting compliance matters, and that reporting compliance matters only helps to make sure that the organization remains viable and that everyone else is safe, including themselves. So they definitely want to immediately report stuff. And if they're all else, they're still not comfortable, your organization should have a way that they can anonymously make a report, either anonymous line that they can call into or an anonymous reporting box where they can report things anonymously to someone. And then also you want to make sure that you have documentation accessible and available to them to write out a compliance complaint or a compliance concern, and they should know where to access that documentation as well.
Absolutely. And these are not the pieces that we like to talk about most, but obviously, if people are not following the program, there need to be some kind of potential repercussions. What can happen if you do not have a solid compliance program that everybody has bought into and that everybody is participating in? What can happen to your organization if that is the result? Can you speak to that a little bit? Obviously, we've all seen this. This does happen,
Yes.
but there are potential serious penalties for not having a proper compliance program in place.
Yes, at the lower the lower end, you can receive a deficiency and be given an opportunity to correct that deficiency. At the worst end, your organization could see closure, and that's something that no one wants to see, especially in the industry that we're in. We want to have as many healthcare providers as possible. So when not being in compliance, you run a huge risk of no longer being able to operate your organization. So you can see fines, you can see regulatory scrutiny, and regulatory scrutiny, and the idea that if a regulatory agent gets a number of complaints against your organization, even when you continue to correct the deficiencies, they can say at some point, we've gotten too many complaints and we're not going to allow you to correct the deficiencies anymore, and then move to remove your license. You also see loss of accreditation, lawsuits that could potentially happen, in the worst case scenario is patient harm or loss of life. And that is the number one thing that we're all trying to prevent.
Yeah, and I want to address also the idea, sort of going back to the idea of getting buy-in from the larger group.
Yes.
And creating that organizational framework. That's really important because, if there is a problem with following the compliance program by any individual inside the practice or the medical site, that one individual could cause something like this, a loss of accreditation, a loss of licensure, to happen for an entire organization, one person. So if you do not, one person can cause that to happen. And I've actually seen that happen, by the way. Not understanding the cybersecurity measures and accidentally, taking patient health information off site. That one breach of compliance can cause huge damage to the larger organization, and that can happen with the oversight of a single employee. So it's important. So when we talk about the culture of compliance versus a compliance program, you want to engage everyone in the organization as part of the team that makes sure that compliance continues to happen on a day-to-day basis.
Right. And as a culture, your employees should feel as though they're stakeholders in the organization. And where they may not be fiscal stakeholders, they're stakeholders in that making sure that the organization thrives also is a part of their own livelihood, and their ability to work and enjoy their work and enjoy their work environment, as well as being able to fiscally take care of themselves.
Yeah, absolutely. And again, that's, structurally, that is the difference. You can have a compliance program where you've got all kinds of policies and procedures, everything written down, training that happens once or twice a year, all of the things that meet the, minimally meet the outline of a program. But if you don't have that buy-in, and if everybody's not participating, if there's not some kind of cultural shift that ensures that everyone is involved and committed, if that's not true in your organization, if not everybody is fully committed, then there is a risk. You're opening yourself up to a risk of those kinds of repercussions, because any one rogue actor, any single person in the group can be the culprit and can cause those kinds of repercussions to happen. And so, compliance is not fun. Don't get me wrong. I get it. I build compliance training and I distribute it and deliver it to thousands, tens of thousands of people every year. So I know that, and I know as I'm building it and looking at scripts and understanding what the regulations are and what HHS says and what CMS says and what the CDC says and all of those various regulatory bodies that are on top of us, when I look at the dense, thick demand of all of this regulatory requirement, I get it. It is not fun. But if you do not figure out a way yeah, if you don't figure out a way to distill it and engage the staff and the people involved, then you're opening yourself up to risk. And I think that's the piece that, as we're talking about this, that I feel is very, very important.
And also, I wanted to piggyback off of that a little bit, because when you think about culture, if one person can, if one person has the ability to, close your organization, that same person has the ability to shift the culture in the organization away from a culture of compliance to a culture of people not, taking things as seriously.
Right.
So you want to make sure that, you don't have that toxic culture shift over time where people begin to slip away from at one point being in compliance to later on now no one really caring about compliance or having discussions about compliance, because at that point it's already too late.
Yeah, absolutely. So just as a wrap up in our final question before we just give you some additional information and follow up here is, as you start to wrap your head around, especially during this very unusual and critical time in the healthcare industry, where all of a sudden compliance programs that were perhaps not adequate prior to what's happening right now, you're going to know right in this moment, unfortunately, if your compliance program is lacking or lagging in any way, because as we all, in the healthcare industry, start to wrap our arms around everything that's happening in the moment and all of the demands on all of the healthcare workers right now, we can recognize that having some kind of, structure and framework around what it is that we're supposed to know about our own internal organization, around the hospital requirements, around the industry at large, and around the various regulatory bodies. All of that stuff is hypercritical, and we recognize it probably more in this moment than we ever have. So if you have not yet built out what you feel is a culture of compliance program, it's time. This is a good time to take some of these recommendations and start to put them together at your site and to think about going forward. So you want to talk about those recommendations a little bit?
Sure. And definitely, I definitely agree with you. If you don't have a compliance program rolled out yet, you want to go ahead and get it rolled out probably right after this webinar. You want to start working on it. So just all you would need to do is sit down and look at your policies and procedures, and make sure that your policies and procedures are in alignment with rules and regulations that we talked about as far as regulatory rules, laws, and things of that nature. You want to identify and train a compliance officer or a designated compliance champion, the risk manager, the quality director. I've seen that human resource director be a champion, a compliance officer as well. So you want to pick someone who will be able to do the job. And then you also have to have that person frame out a training and awareness program for everyone in the organization. So a training program will need to be developed for everyone, and everyone will need to be trained on that compliance program at least annually, and you would need to review it annually, and do an annual retraining of it as well. And then you want to outline a program focused on engaging the entire staff on ongoing participation, much like we talked about as far as maybe like a compliance champion or a safety champion, or some type of incentive to give to your staff members to get involved with the compliance program. And you can really make it a big deal. I would say make it a big deal. Make it, a rollout where you're saying, hey, we have a new compliance program coming out. We're going to be rolling it out on this date. Get ready to start seeing signage throughout the organization, reminding you of various compliance aspects. And then you can even have a rollout celebration, or on the day that you roll it out, you can send maybe like little safety stars to all of the staff or something of that effect. So you can definitely make a big deal out of it so that people understand how important it is going forward.
And the other thing I would say, a couple of things, is one is to get feedback. I think one thing that happens, we have a course in our catalog called Integrative Leadership in Healthcare. And when you talk about integrative leadership, you're talking about engaging those people that you're asking to participate in this new compliance program or in your expanded or changed compliance program. You're asking them to engage. If you're asking them to engage, ask their opinion. Find out what they think. 9 times out of 10, the people around you who have participated at some level in compliance for the organization, and everybody has to do it to a certain degree, for those people, they're going to have opinions about how you've done it in the past, about what they liked and didn't like about your training program, about what they liked or they like or don't like about the policies and procedures review, that sort of thing. Get their feedback, get their input, because the more input and feedback you request from these folks, the more likely they're going to give you buy-in on the flip side. They're going to give you better buy-in if they've participated in helping to structure it. And then the last thing I would say is on that top bullet on this page, review and update your compliance policies and procedures. I cannot, quite frankly, think of a better time in the tenure of our industry for literally everyone. Every organization, every practice, every hospital, everyone, to now step back, process what's been happening for the last several weeks and what we anticipate to happen in the coming weeks and months, and review what you have written in the policies and procedures. Most of us haven't even looked at this thing in years, okay? Let's be honest. Some of us will look at it every year if we're compliance officers, and many of us will not have, we may have glanced at it, but we haven't really dug deep into what this looks like.
Right.
These are critical components of your operation, policies and procedures for your operation. The policies are, what it is that you have outlined is required at your site, and the procedures are the steps involved to accomplish those. Take a look at that, because everything that's happened in the last few weeks and that is going to happen over the next few weeks should impact that. And if nothing is impacted in your policies and procedures, bravo, you've built an incredible book of those. But I would guess, based on everyone's experience to date, that these policies and procedures need to be revisited in order to add and modify based on what we understand about this kind of emergency and these urgent situations. So,
and your accrediting agency has so many things to help you.
yes.
And most of the time it's listed on their website, and you can go on there and they have so many various tools that you can use, and you don't really even need to create anything. You would just need to search for something that fits your organization and use it. And they are always willing to help you out and answer questions or anything else and guide you through creating the compliance program.
Yes, absolutely. So thank you so much, all of you, for joining us during this very complicated time in healthcare. If you had colleagues that were unable to attend, we will send you a follow-up email with a link to the recording of the session if you feel that it could be helpful to other people. You will also receive a code to take advantage of a free compliance course from the Format Training Catalog. We hope that you'll have a chance to choose one that could be beneficial potentially to your overall compliance program. I will add a special note, which is that Format Plus, as a measure to assist our learners and our community in dealing with the current crisis, we have rolled out access to our certified accredited infection prevention program. It's an online self-paced course. It's only about 1 to 3 hours, but it does cover major areas of infection prevention, including PPE and BVP and all of these acronyms that we're hearing on a daily basis right now. Covers all of that. and it also includes a new module that addresses coronavirus and COVID-19 CDC guidelines for medical providers. So it is accredited. It does come with CECME credit. So in addition to the free compliance course code that you'll receive, we will also send you a link to information about getting access to the infection prevention training also for free. So that's a couple of free trainings that you can take advantage of that have accreditation and CECME credit if you need it. And any questions that we have not had time to answer today because we ran right up until our deadline mark will be sent. We will look at those and we will answer them and send them via email as well. Many of us who are in non-healthcare critical frontline roles are working from home at the moment. If you happen to be working from home and you would like to potentially expand on your professional development while you're working from home, you can visit our catalog, which is formedtrainingcatalog.com. And if you like these live events, we'll have more free live events that we'll be posting soon, and you can find those at formedworkshops.com. We also have some old recorded events or recent recorded events, as well as live events coming up in the future for practice managers and medical professionals. So again, thank you so much for joining us. Thank you, Dr. Malachi, for pitching in and having this little panel exchange with us. And we hope to have you back again. And thanks, everyone. And please stay healthy and stay safe.
Thank you.
Thank you.